So you had an experience this week on Monday where a patient came into you and you detected some changes periodontally and also saw some other signs and symptoms of possible diabetes and used the self-screen to determine that she needed an A1C test and then had to deliver some difficult news to her.
Yes, we
How,
did.
how was that for you as a hygienist?
For a hygienist, it's just so, it's wonderful to be able to change someone's life like that in a positive way. You know, she made some significant changes that day that we left. She got a lot of motivation to change some things about her life. She is a patient that recently had a complete hip replacement, and
That's right.
before she had her hip replacement, they didn't check for these kinds of things. They didn't check
Not
to
periodontal disease
No, they didn't check to see if she had any periodontal concerns or any A1C concerns. So, you know, there were enough changes in her mouth clinically to warrant that test, and we uncovered that she is diabetic. She had an A1C of 6.5%. So that was an eye-opening experience for her because she has a family member that has diabetes, so she's familiar with that disease and she doesn't want it. She really wants to try and handle this without medication, and she was willing to do whatever it takes to make that happen. We also put her on the InBody machine today, which is a total body analysis tool to really look at how she's built skeletally, you know, looking at her lean muscle mass, looking at her percent body fat, and what she can do daily to help reduce her chances of having an elevated A1C with diet and lifestyle changes with exercise.
Love it.
So she committed to walking daily. She committed to lots of oral hygiene changes, and we're going to see her to address her active periodontal concerns.
Nice. And reminds me that I need to reach out to her orthopod to sort of ask a few questions about, in a nice way, about what he forgot to do, which is check for periodontal stability and hyperglycemic status.
Right, and we talked about the bidirectional relationship between diabetes and periodontal disease, and you know, with her having a recent surgery, how her white blood cells need to be to that area to heal that particular injury and to let her body go to work to do that, and so how her body's really spread thin with having a diabetic concern and periodontal disease and a recent hip replacement. So she has work to do, but she's excited.
Thank you for the work you do.
You're welcome.
I love it. Thank you.
Yes.